Today, what we want to discuss is the cancer conversation. And I'm a holistic veterinarian here in West Palm Beach, Florida. And I offer local consultations as well as telemedicine consultations nationwide. If you stay to the end of this video, I'm actually going to share with you a free 6-page PDF that will tell you what that's about and how to get that. But today, what we want to discuss is the cancer conversation. Now, a few years ago, I did a video on cancer, more on prevention and treatment. But now we're going to get into more of a discussion of why cancer is increasing and what's changed in our animal companions. I graduated from vet school 35 years ago, and while there were some cancer cases around, it's amazing how it's increased exponentially in the recent decade. Not just middle-aged and senior animals, but also, young animals, 2, 3, 4-year-old animals getting aggressive cancers. So what we've seen is that 1 in 4 dogs will develop cancer at some point in their life. And 50% of dogs over the age of 10 will actually die from cancer. And we're seeing more and more increases in cancer in our kitty patients as well. Certainly much higher than it was 35 years ago. So what's gone into this tremendous increase? Well, the number buzzword again that I've used in many videos is toxins. The cumulative effect of toxins often associated with the conventional veterinary medical model in terms of so-called prevention of disease in our animals. It always starts with food. Processed commercial kibble and canned foods are certainly loaded with potential carcinogens and inferior ingredients. Certainly chemical treats as well, contribute, and the tremendous expansion of flea and tick pesticides that are getting stronger and stronger over the decades. More and more chemicals in one product for fleas and ticks and heartworms, and people are being instructed to use these products every month all year round. Then, of course, we have chemtrails and EMFs, plastics that leach in from plastic water bottles or the plastic dishes. These are all, tremendous stresses on our pets' bodies. And then there's the ever expanding arsenal of mega vaccinations. Not just the core vaccines like parvo and distemper, which are still overgiven every 1 to 3 years by many of my colleagues, but also other non-core vaccines such as leptospirosis and Lyme disease and Bordetella and canine flu. They now even have vaccines for snake venoms. It's just amazing. So it's not a surprise that with all of these toxins that are around, both the environment and what we're doing to these animals in the preventative healthcare model, that we're seeing more and more cancer. And then, of course, once we find out that there's cancer, a lot of clients emotionally just start to panic. And that's the last thing that you want to do. You want to try and remain calm. I mean, it's not going to go away with surgery and chemo and radiation. And we want to try and take a step back and actually think about what our options are. In fact, chemo, radiation, and surgery, in my opinion, actually accelerate cancer in our animal patients. And cancer treatment hasn't really gotten much better over the decades. Lymphoma, the number 1 cancer in dogs and cats, still has the same survival rate it did when I was in veterinary school, 6 to 9 months most of the time. And they're using the same chemo protocol called CHOP that they used when I first got out of school many decades ago. So it's really a war that we're not winning in the conventional vet clinic. So what is the holistic approach to trying to address cancer? Well, we want to look at it as a whole body problem. It's not a disease of parts. That's the conventional perspective, that if you remove a tumor with wide surgical margins, and if you need to use the chemo or the radiation, that will win the war against what's thought of as a local disease if we just keep it localized. But the thing about it is cancer is a whole body problem, and it's actually a defense strategy of the body. The whole body is participating in the formation of tumors or cancers or growths. And what the body's trying to do is to push to the outside a whole body tendency to excessive growth of tissue. So it's actually, the pet's body's trying to do what it can to actually put itself back into balance. So when we remove a lump and we take the lump away, we're actually suppressing that expression. And then the tendency of the cancer is to go deeper into the body, even with a different name. So a good example for that would be a lot of clients when they have animals who are getting their teeth cleaned and they have warts or skin tags or little fatty growths, they'll often have the veterinarian remove these skin tumors. And that's the worst thing, because those are the animals that I see that come back later with deeper cancer, lymphoma of the bowels or hemangiosarcoma of the spleen. So we don't want to remove these external expressions of the body's defense strategy. What we want to do is treat the body as a whole. And the best way to actually address this cancer conversation and the cancer epidemic in our animals is through prevention. And so prevention is very, very important. What we do there is we start again with the species appropriate diet, preferably a fresh raw meat diet or a lightly cooked diet. But the less processed or cooked that it is, the healthier it is for our animals. The more it's cooked and processed and bagged and canned, the more likely you're going to have carcinogens develop and other disease-causing ingredients as a result of the processing and the cooking process. We want to look at issues like even water. Water is the number one nutrient in our pets' bodies. So we want to give our pets healthy water, like filtered alkaline or ionized water, certainly highly superior to tap water or water from plastic bottles or containers. We want to minimize environmental toxins, such as lawn chemicals, house and cleaning agents in the home. We want to be mindful that these are all potential cancer-causing agents in our animals. We want to look at vaccine titers, in other words, where we measure blood tests instead of just automatically vaccinating. And if possible, in my opinion, we want to avoid vaccines as much as we can altogether, except as required by law. So there's nobody that says that vaccines have to be given every year or every 3 years. And you don't want to aspirate or actually remove these lumps, because again, what that does is it's just going to anger the body, anger the disease process, and it's going to accelerate cancer spread. Even tumors that are suspected to be something called a mast cell tumor, which is always thought of as a very aggressive tumor, I try not to aspirate or interfere with to get a diagnosis, because the holistic treatment is the same no matter what the tissue diagnosis is. That's more of a conventional perspective so that they can formulate a chemical weaponry or radiation protocol to battle the cancer. But again, we're not trying to battle anything. We're trying to assist the body in healing a tendency and a defense strategy of trying to push toxins out. And we don't want to suppress that. And then we want to support the gut. That's very, very important. As I said in a previous video, the gut is the window of the immune system to the rest of the body. So certainly rotating good probiotics, or better yet, even using food-based nutrients such as raw goat's milk or kefir, help lay the foundation for a healthy immune system throughout the body. Giving ingredients like bone broth is also very nurturing for the bowel lining. And then we want to look at herbal detoxification. And because we're exposed to toxins in the environment, as I've outlined, and from intentional toxins that are given as part of the preventative model, most animals walking the planet should be on some sort of regular herbal detox. In other words, fresh foods and botanicals that are added to the meals to help with exposure to these toxins and neutralize them. So I often have animals on regular herbal blends containing milk thistle and dandelion, and those are tremendously helpful for helping, again, keep the immune system healthy and preventing cancer from running rampant in our pets' bodies. This discussion is very, very relevant because in a very few short months, it's going to be Pet Cancer Awareness Month this November. But this is a discussion we have to be having year-round in our animals because it really is truly a tragic epidemic. Just this past day, I actually got a very good email from a client who was very happy she had stuck with homeopathy, which is another way of preventing cancer. And in this case, she actually came to me with an animal that had an aggressive tumor in its digits. And most of the local veterinarians wanted to take the digit off or take the two toes off. And she was not going to have that. So we put him on a species appropriate diet, used certain herbs and botanicals, and treated with homeopathy. And it's amazing how the tumor has gone away in just a few short months. So holistic therapies do work. They just take time and patience. My name is Dr. Michael Dim, and I've just launched my new website, drdim.com, which I'm very excited about, which has a lot of good information, blog, articles that I've written. And at the end of my website, at the bottom of the page, there's actually a new 6-page PDF on the truth about pet foods. And we'll be happy to send that to you free of charge if you go to my website and just plug in your email. This is Dr. Michael Dim. Have a wonderful day.